Oh, hi everybody. Let me introduce Dr. Lisa Becht, and she's a double board certified fertility specialist known for her personalized care and dedication to patients. She has expertise in all areas of infertility, fertility preservation, and fertility testing. Dr. Becht graduated from the summa cum laude from Boston University and with honors from Georgetown University School of Medicine, where she was elected to the prestigious Alpha Omega Alpha Honor Society. She completed both her residency in obstetrics and in gynecology and then fellowship in reproductive endocrinology and infertility at Columbia University, New York Presbyterian Hospital. During her training at the Columbia, she was elected to be administrative chief resident and excelled in various teaching and leadership roles. So prior to working at HRC, Dr. Becht was the director of the egg freezing and oncofertility at the Columbia University Fertility Center and an assistant professor in obstetrics and gynecology at Columbia University Irving Medical Center. So Dr. Becht was won many awards, including Vital's Most Compassionate Doctor 2017, 2018, and Patient's Choice Award 2016, 2017, and 2018. She has been active in research with the numerous abstracts, publications, and the national presentations on a variety of topics. Dr. Becht has made a multiple media appearance, including 2 visits to the Today Show, and has been quoted in various magazines, blogs, and news sources. She is a fellow of American College of Obstetricians and Gynecologists and active in the American Society of Reproductive Medicine. Wow!
Oh,
This is amazing.
well, thank you so much for the kind introduction, Dr. Lee. Definitely I'm excited to be working with you. Definitely, I think acupuncture is a really vital part of fertility treatment. Definitely, there are a lot of studies out there, but there's a lot of studies showing that acupuncture can definitely increase success rates and increase pregnancy rates. So being able to work with a great acupuncturist is really important.
You're so generous. Thank you, Doc. So I already explained about yourself so much, but can you tell us a little about your practice?
Sure. Well, so I definitely have a very personalized practice. I like to see all my patients and really do a full evaluation just to make sure we're not overlooking anything. And then at that point, decide what the right treatment would be. And then throughout that treatment cycle, whether it's an IUI cycle or an IVF cycle, I like to be very involved. So I like to do all the ultrasounds for my patients and really be there throughout the journey, kind of throughout the whole time. I like to be the one giving results, giving kind of hopefully some good news. Unfortunately, when there's some bumps in the road, that news as well. So people just really like it because between myself and my fantastic team, we just feel like you get a really personalized, dedicated experience and hopefully get what you're looking for in your fertility journey.
That's very unique, and that's lovely because that's the people really need for this journey though, because it's very stressful, and then they have somebody they can trust and give those personalized approach. I think very valuable. Thank you so much.
Absolutely. You're welcome.
So I'm kind of curious, what made you to be in this field, in this reproductive endocrinology field?
Yeah, well, so I've always been really interested in science and medicine, so I knew I wanted to be a doctor. And then in medical school, I had the opportunity to have a couple different electives where you get to go see different things. So just by chance, I went to this reproductive endocrinology and infertility elective, and I just thought it was amazing just to be at the forefront of science and being able to obviously be part of such a big part of many people's lives in terms of the fertility journey. So I love that. I've always loved genetics and endocrine, and then I really liked the obstetrics and gynecology aspect. So it all just kind of came together, and then I solidified that by doing a couple other rotations along with a couple different fertility specialists. And so I love what I do. I love hopefully getting people pregnant and just being a part of such an important but obviously emotional and obviously sometimes very hard journey. But definitely, usually, hopefully that end is a bright spot and it's just fantastic. Definitely the best part of my day and my job is doing pregnancy scans and then obviously graduation day.
Oh, Thank you so much, because I can already feel that warmth and smile, and it makes me
Oh,
feel
thank you,
like
Dr.
I'm in
Lee.
a safe place. That's lovely. So more little technical question I'm hearing from my patients a lot. Actually, today, right before I come, actually, I had a patient with endo metriosis, but
Yeah.
also we hear a lot about the egg quality issues,
Mhm.
especially our patient. Probably like over 70% of our patients over 35 age group in our clinic.
Yeah.
So they asking, is there anything patient can do? So the more patient empowering patient can do to improve their egg quality. I'm hearing a lot. Do you have any suggestion?
Yeah, well, that's a great question. So really kind of inherently egg quality is most importantly, unfortunately, dictated by age, which is obviously something we can't change. That being said, the good news is that certain supplements and lifestyle changes and definitely things like acupuncture have been shown to potentially help boost quality at least a little bit. And so in terms of what to do specifically, definitely first and foremost, taking the right vitamins and supplements is important. So definitely I recommend a prenatal vitamin with DHA. There are certain prenatals out there that have other things, so things that can, help regulate your cycle or help boost metabolism. Definitely stay away with those. I really like to have very specific everything kind of separate. So the prenatal vitamin with DHA, coenzyme Q10, which is an antioxidant, is definitely something that at this point in time studies really show could be helpful to helping egg quality. In the past, sometimes we were only giving it to women that were a little bit older, but at this point, really, there's studies showing that it helps mitochondria, which are the mechanisms in the cells for energy. And so by being able to help those cells, we think really it could be something that everyone could benefit from. And beyond females for egg quality, I also recommend if they have a partner that the male takes it as well for sperm. So definitely coenzyme Q10. Vitamin D is crucial to fertility. So I'll always check a level and kind of be able to tailor how much you should take, but almost everyone, even if they're taking them already, usually need a little bit more. So definitely vitamin D. In terms of other things, lots of different studies out there, melatonin, NAC, all sorts of other supplements. Definitely I always chat with patients as to kind of some of these others that maybe aren't so clear cut in the actual studies. But that would definitely be something at a consult I'll go through. In terms of kind of other supplements, so sometimes I know certain acupuncturists might like to give out certain supplements. If they have things like phytoestrogens or anything with estrogen-like components, that's great if someone is doing acupuncture and that is their fertility treatment. But if we're working together, just because if that might change what their estrogen level is or what their response is to our medications, definitely I would say to hold off on any type of supplements that might have kind of other things in it that might impact their estrogen levels. That being said, the acupuncture aspect with the needles, definitely I always recommend that to all my patients. I always say try it once. If you really like it, definitely I think it could be helpful. In terms of acupuncture, obviously, as you know, we know it increases blood flow. Definitely if someone likes it and it's decreasing their stress, which is their cortisol level, absolutely could be extremely helpful. Other times some people might not like it quite as much, so that would be up to them, but definitely overall studies show that it definitely could be helpful for getting pregnant and definitely in an IVF cycle, especially at the time of transfer.
So especially like a before and after.
Definitely. And then kind of beyond supplements and acupuncture, definitely I know some acupuncturists like to potentially offer other things, certain massages, things like that. So obviously I defer to you guys. And then just other lifestyles. So definitely as clean of a diet as you can. So healthy eating, trying to avoid gluten, avoiding processed foods. That being said, sometimes I think people might take it a little bit too far. So I don't recommend going on a major diet. Definitely I don't like things like intermittent fasting or a keto diet or anything that might be taking energy, away from the ovaries. Same thing with exercise. Exercise is good, but in moderation. Definitely don't want to start training for a marathon while you're trying to get pregnant, or doing really, really high intensity interval training, or again, anything that might be taking energy from the ovaries. But again, being healthy diet and exercise is definitely really important. And then other lifestyle things would just be avoiding any major toxins. So definitely smoking, marijuana, anything that might potentially be impairing both ovaries or for men for the sperm.
I had one patient came and she was actually taking CBD because of she had a little anxiety, and I said maybe not because we still don't know. It's great for like a pain, but
Yeah.
at this time, probably no, and then maybe
Yes,
for something more.
yes, definitely agree with that.
Uh-huh. All right. So you already actually explained a lot of my other question I had it. That's wonderful. And so you said the acupuncture you utilize to like help more uterine lining and then stress
Mhm.
reduction, like a correlative relationship. And is it any specific with the ART, like just transfer day and before? Is that what your recommendation for patients?
At my first visit, I recommend acupuncture to everyone. I always say go for a visit and see what you think. Honestly, for some people, even if they're potentially continuing to try on their own for a few months or doing something like an IUI, definitely I think acupuncture can be helpful. So honestly, I always recommend going for a consult and doing it throughout and then even continuing into pregnancy. That being said, sometimes people, maybe aren't quite as interested or time-wise or whatever it is. So if I could only pick kind of one specific time that you should really do it in terms of kind of the stress reduction and decreasing cortisol and lining would be around the transfer. But that being said, I have patients that do it throughout the whole process and journey, and definitely I think it helps them. I think it can help with blood flow to the ovaries if you're doing IVF to get more follicles potentially, or how they grow. Definitely women with decreased ovarian reserve or high follicle stimulating hormones, definitely there's studies showing that maybe it could help a little bit with that. So I recommend it to everybody, and I kind of leave it up to the patient as to how far they want to take it. But that being said, I'd love to hear a little bit from you about kind of what your typical kind of regimen is, because a lot of times patients will ask me, and I've heard different things from different people. So I'd love just to hear what you offer, just because patients will ask me, and I always say, well, different practitioners do it a little bit differently.
Right. Especially when patient going through ART, that honestly, I'm actually limiting a lot of estrogen factors. So we don't recommend much herbs. But I totally agree with the supplement part of you are recommending, and I love CoQ10, or we have a patient going through after like endometriosis, I said, as a surgery, and then I go for more alpha lipoic acid and CoQ10 and all those. And then NAC is one of my go-to like a detoxifier, so I love it. But the unique about our practice is we also have a more the lifestyle medicine aspect, so the how you can de-stress yourself. And
Perfect.
I love people coming, and sometimes it's hard to get rid of stress itself because there's a reason stress is there, and then we have to learn how to cope with it. So acupuncture, people using it as kind of an outlet for stress, so that they come, and then we teach them a little mindful breathing technique. So the 20 or 30 minutes is not just they cannot do anything and they're like stuck in the needle. So we utilize like a breathing method, and then they can do calm down, and they can use the actually auto from the practice as well. So the learning and then have another tool in their toolbox is very important. And we have a special abdominal massage technique. We teach patient though. We don't want to do all ourselves as the therapist, because we want patient to learn, and then they can do their end, and then it always make our success goes up. So we teach them how you can do home massage, and that also we utilize special light therapy, like a low-level light therapy, low-level laser therapy, LLT, and I'm seeing very promising because it's excellent for anti-aging effect and then also lowering inflammation. So that is we do for all our infertility patients. And then lifestyle, eating properly, so that before they start the treatment, I go over their diet, something I can help them. The one patient came and she asked, do I have to stop drinking like a dairy product? Or then depends on if she has like a endometriosis, I might try to limit more, but if it's not, then why not? Good fat is good for you at this time. So the lifestyle. And other than that, our acupuncture technique is, as you know, we're not only targeting reproductive organs, we all target whole system same time. So the point is definitely related with their symptom they are want to improve, but the de-stressing point will be definitely implemented along their major target problems.
That makes sense.
We recommend for generally, like if the people actually finding us like during their IVF cycle or doctor recommending, we can definitely make that plan possible. Or we have a quiet patients coming in the natural fertility process. and we do more full like a herb regimen along with that.
That's great. Well, that sounds fantastic. Sounds very complementary to kind of between both of our practices that we practice very similarly.
We are lucky enough to have so much like a support from the OBGYN or like a reproductive endocrinologist, even the patient. But we want to make sure we have everything available for them instead of make a patient to go here and there. So that's why we are bringing more information and the knowledge, and fortunate enough to have the support from a lot of doctors, but we try to like learn and then advance every day. That's our goal. So we're not only in ancient medicine field, we are reading a lot of the studies and then how we can share this information with the patients. Probably our goal for our fertility patients.
Yeah,
so before I maybe let you go, Doctor, can you share like how the patient can find you? Like, can you tell us?
Sure. Well, patients can find me either just directly on our website, it's havingbabies.com. I also like social media, so I have a Facebook page, Lisa Becht MD, and my Instagram is Lisa Becht MD, so patients can definitely find me there. I actually love doing Facebook Live, so maybe one of these days you and I could do a Facebook Live.
I love it.
Yeah, before COVID, I actually wanted to come get acupuncture myself and do a Facebook Live or something like that. So maybe we could figure out something fun, because like it definitely seems to be practiced very similarly and complementary. So it'd be really nice for patients, that could go on my, social media and see you and vice versa. But definitely, I think, there's information obviously about acupuncture, but you take it obviously one step further. You do kind of the full body, talking about nutrition. Like you said, reading studies to make sure you're doing really kind of evidence-based supplements and everything. It just sounds fantastic. So I think it'd be great if we could do a Facebook Live one of these days. And so Facebook Live, it allows the audience sometimes to ask questions in real time, which is definitely interesting. So if you're interested, we could always set one of those up.
Oh, I love to do that. I love to do that. You are so close. You are welcome anytime, our practice, Doc.
I'm what?
You are welcome anytime. You are so close. It's like, I can walk to your office.
Definitely, I know. Well, we could figure one of those out, but that would be fantastic.
Okay, so is there anything? Maybe I know you're a busy doctor, and then I so appreciate your time. Is there anything you want to share with us if some people watching this or anything?
Well, definitely, I just love talking about fertility, and definitely I think fertility has just a lot of different facets, and so I think working with all the different parts of it, which would include acupuncture and kind of full lifestyle, is really important. So definitely, I would love to obviously see patients. I think our consult is always the first step. I know fertility can be a scary thing to think about and talk about, but definitely kind of making that first step to come in, at least get information, maybe do some testing, and at that point figure out what type of treatment makes sense.
Sure. So I'm gonna